Hi, I'm Dr. Cantu. We're talking about conditions that respond to neurofeedback and my special brain activation techniques. So with regard to some of the cases that I've had in the past, these cases are both severe and common, both categories. And some of them are life-changing. These cases are life-changing. They don't apply to most people, but the process that I use to evaluate the brain and actually improve the brain are the same. An example, I have a patient that had a stroke, and in 5 sessions we were able to restore partial blindness. So I actually wrote and I presented the paper to a group of behavioral optometrists, and this was actually validated by before and after visual field exams, and the ophthalmologist actually had them repeat the exam because she didn't think it was done correctly. Another case is of a patient that was born with hydrocephaly, water on the brain, and had a stroke, and actually had, on top of the shunt from the hydrocephaly, had a stroke at age 5, had a lot of issues, and started having seizures. And we were able to reduce her seizures from 30 to 40 a month down to 2 to 3 a month. Once in a while she'd have a month where she had absolutely no seizures. Had a patient that was referred from out of the area and came to do my intensive program. So that was 2 treatments a day for 3 weeks in a row. And as it turned out, the first session actually changed the way he felt, and this was a post-traumatic stress disorder. Patient had been hospitalized and disabled for 4 years, and he was suicidal. A few months later he was back to work. Patient with debilitating migraines after he had a head trauma, had a bleed, and then they had to do brain surgery, left him with depression and sleep problems and migraines that were debilitating, and it would cause him to have to go to the hospital for relief to try to get some shots. And in about 5 months, the migraines were completely gone. A patient that had a stroke that couldn't read was able to read again. First she just interpreted the page as squiggles. Eventually she started reading children's books, and now is able to read functionally, and actually has a much more emotional balance than she had before the stroke. So these are examples that don't apply to most people, but the point is that these conditions are all improving because of the process that I go through. So we're not picking isolated symptoms to go after. We're fundamentally improving how the brain works and addressing the weak areas or overactive areas. And I combine my neurofeedback with activation techniques. Very effective for ADHD, ADD. Specific learning problems can take place just because one area of the brain, one lobe, isn't working properly. For example, the left temporal lobe, directly related to math. If that has very low energy or maybe very overactive energy and is out of balance compared to the right temporal lobe, there's going to be problems. If the right temporal lobe is out of balance, it could create a lot of emotional and behavioral problems. So sleep problems can improve. So we're not targeting a symptom, we're improving the brain. Sleep problems can improve focus and concentration, memory, mood, behavior, judgment, alertness. In order to properly evaluate these individuals that have symptoms, we need to put sensors on the scalp. This is going to help us determine where the areas of weakness or overactivity are in specific areas of the brain that are driving symptoms. So now we have a starting point to be able to treat because we've uncovered the information that's causing symptoms. The best thing you can do for your brain, give me a call, we'll schedule a consultation and get this process started.